Minister, I welcome the publication of this Women's Health Action Plan. I think it's good to have concentration of the issues brought under one document to put a focus on that. But I would say that it's important that we bear in mind that women's health issues should be mainstream issues. And sometimes when there are women's sections or women's groups, that can result in sidelining those issues. So women's health issues should absolutely be mainstream and front and centre of the health service. As I say, it's good to bring the various elements together in this, but it does amount to really a repackaging of several initiatives that are already in train and have been announced for some time. For example, the additional lactation consultants in the National Breastfeeding Action Plan. And that was a plan between 2016 and 21. It hasn't been fully delivered on. The regional fertility hubs, 4 of the 6 of those are already operational. And that's a 2019 plan. New specialist eating disorder teams, that was a 2018 plan. It hasn't been delivered on. The new specialist, the mother and baby units, the specialist perinatal mental health model of care, it was 2017. So it's fine to bring those together, and you talk about radical listening, and that's very important, but we also need radical action in relation to implementing a number of those plans that are already in existence and are moving very slowly. And I would say that the commitments still fall quite far short of what is actually needed or recommended in previous plans. Also in relation to target setting, there's no targets for the reduction of gynaecology waiting lists, for example, and those waiting lists currently stand at 35,700. 35,700 women on waiting lists for gynaecology services. So, targets for those would be really welcome. I also think there's something that has been omitted from this, and that is the role that cost plays in relation to being a barrier to accessing care. That applies to people across the board, of course, men and women, but for women in particular, cost can be a barrier to accessing services, and it's really important that that should be referenced. The other point I would make is that in terms of ensuring that services are responsive to women, it's very important to have women involved in decision-making in the health service. We saw with NEFIT, for example, and throughout the last 2 years in respect of COVID, there were very few women involved at a senior level. And time again, we saw, the NEFIT press conference and then the various ministers that had a responsibility in that area, and not a single woman among them on a regular basis. So it's important that we have women involved in decision-making and on interview panels. And I note, what happened there in relation to the new master of the Rotunda. 10 of the 13 people on the interview panel were women. Sorry, were men. 10 of the 13 were men. So, we need people at senior levels in the health service and at decision-making levels. In relation to radical listening, and I echo what Deputy Whitmore has said, you haven't displayed radical listening in respect of the National Maternity Hospital, the flagship development in respect of women's health care. You and your predecessor listened to St Vincent's, you listened to Holles Street, but you didn't listen to women, and you're continuing to fail to listen to women in respect of what they want. The vast majority of women, and we know that the Uplift survey showed that 73% of the public want you to actually take steps to purchase the site for that hospital. It is utterly unacceptable that this was a deal that was hammered out between 2 hospitals without reference to the people who would be using that hospital, without reference to women. And that's a huge failing. There is no justification for handing over a €1 billion asset to private interests, irrespective of whether they're religious or otherwise. That's the first point. But of course, the fact that this is a religious organisation, St Vincent's Holdings, about which we know very, very little, but it is the successor organisation to the Religious Sisters of Charity. The fact that you're handing over the control of the hospital to that body is completely unacceptable. And I note what you said this morning, Minister, where you said about the importance of independence, and you said there'd be an absolute guarantee of full independence. There cannot be independence if the new National Maternity Hospital is a wholly owned subsidiary of St Vincent's Holdings. Now, that is the proposal that is there on the table. That is what is planned by you. And in those circumstances, that new National Maternity Hospital cannot be independent. And I'd urge you, Minister, to face up to that fact. Thank you.